Hi guys, it's Janae and thank you for tuning in to Daily Dental Hygiene. Today I'm going to be talking about vitamins and how they affect your mouth. So I'm going to be talking mostly about B vitamins and iron, and this was actually my senior project. My senior project was you're not proficient when you're iron deficient. So I know a lot about this topic and I've done tons of research on B vitamins and iron and how they are literally the make or break of the basis of oral health. So this is something that's important to me because a lot of people have dietary restrictions. They can't eat certain things, or they are vegan or vegetarian or whatnot. And I have nothing against vegans or vegetarians, but a lot of them cut out very, very massive food groups and then are not taking a daily supplement and making sure that their blood work is correct. And in turn, it shows in their mouth. I have been able to diagnose vegans and vegetarians so many times. I can open up someone's mouth and ask them, are you vegan? And they'll say, how do you know? I'm like, it's so obvious because they are lacking so many essential vitamins and not taking supplements to counteract that, and their mucosa is showing. One of the main things is geographic tongue. You'll start to see that the tongue starts to bald and lose its papilla. You can see the paleness in their mouth from iron deficiency. So B vitamins, this is a little nerdy fun fact. B vitamins are coenzymes. They are what do all the processes in the body. They give your body energy and fuel to break things down, to build things. Coenzymes help reactions happen in the body. So if you're missing B vitamins, which is a huge, huge, huge part of your body's overall function, your body can't repair itself well. So think about it. Your mouth has hot, cold, spicy, acidic, everything. The cells in the mouth proliferate and are able to replicate and fix itself faster than any other parts of the body because it has to. All day long, our mouth is what's taking the biggest beating, right? We eat and drink everything that is so hot, cold, spicy, and acidic. So your mouth has a lot of work to keep up on. What I see is a lot of papilla and I see a lot of just periodontal breakdown. Like the tissue doesn't look healthy and pink. It can sometimes look kind of fibrotic and kind of deoxygenated, and that's why iron is important. Iron is what carries oxygen throughout the entire body. This was my senior project when I graduated. You're not proficient when you're iron deficient. That was my big senior project. My board, because I know how important iron is. So think about it. What thrives in deoxygenated environments? Nothing damn good. Gram negative, anaerobic, bacteria that causes periodontal breakdown. Iron is also super, super important. It leads to ulcers. It can lead to bone loss. The tissue sloughing, burning mouth is a huge symptom of B vitamins and iron. So make sure your patients know. I've seen a lot of tongues that they just don't look correct. Like you can see that they're losing fiber and they're losing stuff like that. So make sure that your patients know that you can take like a Super B complex. You can get this at any store, and it's called a Super B complex because it has B3, 6, 9, 12. It kind of has all the B's in one pill. What's great about B vitamins is it's a water soluble. So whatever you don't need in your body, it just pees out. So you're not gonna OD or go into the hospital like from taking a Super B complex every day. Your pee might look a little more yellow, but that's just the body excreting whatever B vitamins it doesn't need. It's super important to keep the vitamins at a healthy level and get your blood work done at least once a year. And keep in mind, like when you get your blood work done and it shows you're iron deficient or you're low in certain things, don't just see that and say, okay, whatever. Make sure you're actually staying on top of that so that your body is all a balance. It's all a system. So if it's not getting enough nutrients in one area, it's not going to be able to do its job, and other parts are going to have to compensate. So make sure that your patients are taking their B vitamins and their iron vitamins. So many women are iron deficient And it is a huge part of having a healthy mouth. My research has shown that you're more susceptible to cavities, to ulcers, deeper probings, periodontal breakdown. Patients lose their teeth sooner than people that aren't iron deficient. It has so many impacts on the mouth. So please take your iron and your B vitamins, and tell your patients too, so that they are not losing their teeth and having lots of issues. I've seen so many ulcers in people's mouths, and I've asked women, have you ever been diagnosed with iron deficiency? They're like, yeah, all the time. I'm like, do you get these ulcers all the time? Yeah. Have you ever thought about taking B vitamins and an iron supplement? I think that this could absolutely help you. And I've helped a lot of people that way. So it's okay to be vegan, it's okay to be vegetarian, it's okay to have whatever dietary restrictions you have, but just know that if you take something out of your diet, you have to replenish it in another way. So just be smart about, whatever changes you make to your body. Bye.